Thank you, Chairman Graham. And I just want to start by thanking you and Ranking Member Leahy for your bipartisanship, for your passion, for your commitment to ensuring that we have thorough and productive hearings, that we look hard at the human suffering and at the opportunities we have to do good in the world, but to do good well, and to do it in a way that is sustainable and bipartisan and effective. I really appreciate your leadership on these important and valuable issues. And I want to thank the panel today for reminding us of what it means to be American and what we can do when we do the best in our national spirit and we bring our best capabilities to the fore. Reverend Warren, I appreciate your reminding us that we have a scriptural injunction to not withhold good from those who deserve it when it's in our power to help them. And Sir Elton John, I appreciated your compelling and personal testimony about how a change in your own life was brought forward by Ryan White and the dramatic impact that you've made across the world, and how the two of you in partnership really are helping demonstrate what it means to accept, to welcome, to love, and to celebrate a wide range of people who are otherwise suffering. I agree with you that fighting stigma against LGBTQ community in Africa is one of the most important things we can do to avoid marginalization, to avoid the spread of the disease, and to frankly show our humanity. And so in my limited opportunities as the Africa Subcommittee Chair the last 4 years, visiting 15 countries, I've tried very hard to press that point because the human consequences of ongoing oppression based on orientation are very real. And this is a very real threat we all face across the world. If I could, to Mr. Dybul, thank you so much, Dr. Dybul, for your leadership of the Global Fund. As you know, in the last Congress, I introduced a maternal and child health bill, which I'm hoping we will renew in this Congress, and that would give access to some innovative financing techniques to strengthen the amount of resources available for maternal and child health. That's really the core issue we're talking about here today, is how to sustain in a difficult budget environment these vital investments. Tell me, if you would, what are the opportunities here for innovative financing, and what, if anything, do we need to be doing legislatively to help facilitate that?
Thank you, Senator Coons. Innovative finance is a big field. One of the most important things to do is to get other countries to contribute, as the chairman was mentioning, and we are actively pushing on that all around the world, not just from the traditional donors, but from others. And I would amend that Germany is actually number 4. I got that wrong. But the innovative finance field, and I can give you some examples, is an extraordinary opportunity. So social impact bonds, we're actually working now in Nigeria. We are forcing matching, as I mentioned. They have a $100 million gap to meet their bed net need. We have incentive funding. We said we'll give you 50 if and only if you cover the other 50. So they're going to float a bond. It looks like they will float a bond in order to cover that $50 million. So that's one opportunity. Another is around high net worth individuals. As I mentioned, we are actively pursuing high net worth individuals. We understand that all accounts are constrained, not just in the US, but all over the world. So we need the private sector to be doing more. High net worth individuals have enormous wealth. And as I mentioned, we already have raised $100 million, and that was working with Bill Gates and others, but we see huge opportunity. But it's not just the money, it's how we're going to use it. We're actually trying to build trust funds, public sector, private sector trust funds that match the public sector investments. And this does 3 things. One is it puts more money in. Secondly, often high net worth individuals in a country like Korea or China or Vietnam are among the most influential people in the countries, and they're worth billions of dollars. They are now putting pressure on the government to increase their contribution because they're putting in money too. And the third is around innovative implementation. They're saying, if I'm going to put money in, I want an efficient system. So get your efficiency up. You know, let's work together on supply chain. Let's work together on procurement systems. Let's work together to bring these private sector practices. So those types of innovative trust funds are huge opportunities for us as we are moving, so countries are funding more and more of their own programs. There are many other opportunities around innovative finance that we're exploring. Countries are doing extraordinary things. Senegal and Kenya have some of the most, and Tanzania, some of the most innovative programs where they're doing special tax schemes, where they're doing special bonds and funds internally to raise money within their own country. So it's a huge opportunity. Thank you for raising it.
And one I look forward to working on. I just visited Senegal and Kenya last month, and as both Sir Elton John and Reverend Warren have shown, the capacity of the private sector and of charitable individuals to make a significant impact here is impressive, and we need to deploy further. Dr. Birx, Ambassador Birx, as we saw in the response to Ebola, there were Americans and folks around the world who stepped forward and made individual contributions in the hundreds of millions of dollars that also helped accelerate EU engagement, multilateral engagement. But one of the other lessons, I think, of the Ebola experience was that PEPFAR resources and training were credited with Nigeria being able to rapidly identify and contain the one outbreak into Nigeria of Ebola. What are you doing? What's the path forward for integrating PEPFAR investments into a process of building broader health systems to prepare for the next pandemic? And tell us just a little bit more, if you would, about two programs, the ACT program, Accelerating Children's HIV/AIDS Treatment, and the DREAMS initiative, which you mentioned in passing, but I'd love to hear a little bit more about in the minute and a half we've got.
Great, thank you. So we have intentionally strengthened health systems because without a health system that can provide commodities, without a health system that can diagnose disease at the laboratory level, without a health system that has actual health providers at the health center, it wasn't going to be a functional system. So it's been very deliberative and very much matched the services we're providing. But of course, a nurse at a health center, although she's providing HIV tests and referring patients and often treating patients, she's treating all patients in the community. And so although they may be trained and provided by PEPFAR, they're there for the community. And I think we've seen in every other Ebola outbreak that has occurred in the DRC and in Uganda, a rapid community response and a rapid medical and scientific response because of the infrastructure that has been built in the PEPFAR countries. Indeed, within Nigeria itself, the FELTP program, their field epidemiologic trained individuals that were there for polio, trained by PEPFAR, but also utilized in polio, became the absolute core. But underneath all of that, you have a global health core that's been funded and built by PEPFAR around the world. Thousands of individuals in countries who are part of the U.S. Embassy, who were also deployed to these countries and were the immediate rapid responders. And so on the continent, you have now highly trained public health individuals, both host country nationals and direct hire staff. ACT and DREAMS are two very exciting pieces because it illustrates when you intentionally seek private sector engagement around a core program, the private sector will stand forward. And so having the Children's Investment Fund Foundation come forward with $50 million made it possible for actually to achieve the goal of doubling the number of children reached by PEPFAR. Only 24% of the individuals, children under 15 in need of treatment, are receiving treatment. So this was really a key initiative. The DREAMS initiative, which Mark and I are working very closely on, really to empower young women to remain HIV-free. I mean, the statistics are overwhelming. 5%, 10%, 15%, 30% prevalence by 20 in areas of South Africa. And same thing repeated over and over again. This is a program that I have to tell you, when I said that this was high risk and we were entering into unknown territory, this is a program that we're relying on a completely different approach, ground up planning, bringing everything to the table, from the social structure to the community structure to the family structure to the school structure, to really figure out what the most disadvantaged young women need in order to remain HIV-free. And we have a lot of what we call monitoring and evaluation around it, so we can immediately tell what's working and transform it into the other countries. So thank you for those questions.
Well, thank you. And I appreciate the very hard work that you're doing with PEPFAR and you're doing with the Global Fund to make sure we have data, we're doing analysis, we're delivering services more effectively, as Sir Elton John's Foundation has demonstrated. Better integration at the community level is vital, and as Reverend Warren's community health training in Rwanda and elsewhere has demonstrated, we can do this effectively, but we have to do it in different ways, and we have to do it in a more sustainable way if the vision of the end of AIDS within our lifetime is to be achieved. Thank you for your great work.